Hello, my name is Dr. Mikel H-G Hoff. I'm the founder and inventor of ANF Therapy. Today I will talk to you a little bit about the current situation and what you can accomplish with ANF Therapy and what it means for you and your patients, which I think is really important because I know a lot of you out there that is not common and know what ANF Therapy is or can do. Maybe you heard about it. It can actually make a big difference for you personally as a therapist or medical doctor, whatever your background have, but most of all for your patients, which is absolutely the reason we are doing the work we are doing. During 30 years and a long time, I've been working with a lot of complicated situations with patients and had a lot of problems to actually accomplish the results that I want. And you are probably using a lot of these methodologies and equipment today and stand in the same situation, which can be time consuming and many other issues. You are probably today using a lot of different modalities to actually create results for your patients, like maybe laser therapy, ultrasound, or a shockwave, where you have some impact on the patient's problems. You are probably also using a lot of different manual therapy as massage, adjustments, and do a lot of work to actually help your patients. Maybe even helping them to get some braces, knee protection, or any kind of medical device to actually make their everyday a little bit better. Even give them a lot of exercises and educate the patient how to actually act every day. This is a lot of time consuming work that you do every single day with different patients. For the patient, you know as well as me that they probably have first experience directly after whatever you did are very satisfied. You notice a big difference, but it's very short-term results. Very often you hear when they come back to your clinic that they have relapses, they feel the same and not be able to remove the active impact of inflammation can be very, very frustrating. This is also for the patient point of view, have a big emotional, mental impact to not feel that is any progression. And this can be very, very frustrating and it's time consuming for them because after some while they maybe drop off of your clinic or just stop because they don't know and feel any different. And this, of course, during all my years of working and understanding the impact of the nerve system and how it controls everything. Scientists have known for many, many decades that if we can improve the neural oscillation and strengthen, we will absolutely get a lot better. ANF Therapy offers you a big difference and change of your clinic's daily work and also for you as a therapist, MD, GP, whatever you're working with. We are using the ANF Devices. The ANF Devices is a small medical device that is charged with neurological frequencies. Frequencies that have the impact to create fusions between different cells and actually create a long result. For you, this means also when you go and learn how to use this device and doing your education, the personal knowledge of why things is happening to the patient will make your personal growth and self-confidence and professionalism increase to another level. Together with the knowledge you have before, it will all make sense. To understand the neurological and biochemical influence and by the human body, to understand why we get problems, diseases, inflammations, or how it impacts an injury and actually be able to do something about it means a lot for you as a therapist or doctor, but also for your patients. The personal growth by having knowledge that few people in medical healthcare have, but you will make a big difference of your clinic. Also, of course, the financial impact and the reputation will change. And we can see that of hundreds and hundreds of clinics around the globe that today have learned ANF therapy. What does this really mean for your patients? Actually, the first of all I can say to you is that is really important is the quick effect. The quick effect to be able to remove active inflammation and have long-term results will change everything for you and your patient. Here you will have a positive emotional and mental impact on your patient that will feel the difference in minutes and it stays like this. And also the deep knowledge of the human body and neurological biochemical function, your ability to explain for your patient what's happening, why they feel what they feel, and also because you have learned to do a clinical examination to feel the nerves and find the source, and in this way create a really long-term good result, will make the patient satisfaction grow massively. This will improve your reputation. It will also improve the patient's life And you will earn a trust from the patient in the way to actually create an impact on them that very few clinics have. I really hope these kind of arguments will take a decision in your mind that this is something you will learn. And I personally guarantee you, you will not believe what you see, and you will learn stuff you never even heard about, and your personal goals and knowledge, and also for your clinic, will come to a new level. I will talk to you a little bit about chronic injuries, and that can be many. It can be also organs with many impacts, but today I will talk about chronic musculoskeletal issues. We can talk about rotator cuff, we can talk about hamstring strains, we can talk about tennis elbow, we can talk about neck pain or simulated whiplash injuries, many different things, and the difficulty it is to help this patient and get improvement. Because to be able to do that, it's several things that we really need to understand here, and is to understand the root cause of it, where it comes from, and the impact of every single issue that we have to make it better. We need to be able to remove the active inflammation. We need also to be able to examine the patient in detail to actually find out where it's located, where it comes from. Because every diagnosis is just exactly that, a diagnosis. To make the patient better, we need to understand the body is a full unit and to be able to treat everything that is connected to the area and not only locally. We need to understand the neurological and biochemical impact of this chronic injury to make the patient better. Examination technique. What we learn here at ANF Academy is to do a detailed examination and palpation. The highest level of palpation skills that is called clinical surgery, to feel and find the nerve. This is essential because the nerve system never ever lags. You will learn to feel the exact difference in the tissue, in the muscle, in every different layer, and exactly how a good tendon should feel and not feel. You need to learn how to feel the difference of a full edema exploration or non-edema. You need to find and feel the difference between a normal nerve or an inflamed nerve. And what does it really mean for this chronic injury? And what is the difference when you treat it and it's getting better? You need to understand the impact of the blood flow, of the circulation of blood and nutrition, and all these biochemical neurological aspects to be able to helping the patient. Because otherwise you're just treating the symptom and you're not treating the source. And this is what we teach here in extremely high level for you to create really good and positive results for you, your clinic, and most of all, for your patients that probably suffer for a long time. We need to understand that when a chronic injury will become chronic, we need to understand the biochemical neurological negative impact of increase of toxins, bacteria, and lack of immune response, and the body's ability to actually heal itself is probably gone. We need to understand a chronic injury can have 3 to 10 years development until the patient start to feel extreme pain. That's when we go to the medic, and that's when they come to you in a later stage. We will teach you to find it in a very early stage and do something about it. An ANF therapist have the abilities and the skills to feel the difference of an impact muscles. To feel a muscle, how it feels when it's totally healthy, even the structure of the fibers, and how to feel it if it's strained or fiber ruptures or any other negative impact on the tissue. How does it really a healthy neck feels, the palpation resistance. They learn to feel by their hands that the palpation resistance will tell you how long have this injury been, what kind of device do I need to do, how can it have influence on the rest of the body, also the emotional and mental impact, which is for any chronic. And if it's an athlete, it's even worse to not be able to do what you love. If it's a normal patient, to not be able to do the things you do at home. When you do examination of a whiplash injury, it's extremely important to be detailed. Few parts of the human body is so complex, that's our neck and the cervical spine. You need to have high level of skills to examine the neck and even the vertebra and go in between every single tendon and to find a source of where the pain comes from. You need to understand the cervical spine and also all the muscle that's connected to our neck to be able to find if it's healthy or not. To find these details will give you a lot of knowledge what you need to do with the patients. To be able to measure the palpation resistance in the neck muscles, the stability in even every single vertebra in the neck, to feel the ligament and tendons in between the vertebrae, and also go in between every single muscle to find a main nerve that is connected to this. This is essential technique that you must be able to handle and be a master on to create a high level of and quick results. When it comes to chronic epicondylitis or tennis elbow, if it's medial or lateral, it doesn't really matter. The reason you probably not get the results that you want with the equipment you have, it can be laser, it can be shockwave, it can be ultrasound. It may get a little bit better, but it's really irritating pathology that this patient have. Maybe for you as a therapist or MD, whatever background you have, but for the patient itself, even worse. We need to understand how this is happening. It can be tennis, it can be your office work, but it can also come from your neck, from your shoulder, and spreading to the elbow. Because every single joint having high impact and taking a lot of damage. If this inflammation is spreading, for example, from a biceps tendonitis inflammation and going to the elbow, it can take long time, and one day the patient will complain over tennis elbow or elbow pain in general, and then you need to be able to examine. You need to learn to understand the connection from the occipital muscles and nerves all the way to the shoulder, to the bicep tendons and the biceps itself, and examine every single muscle to find exactly where the source comes from. Because when you learn the CST training to examine after the nerve system and palpate after the nerve system, the closer to the source you come, the extreme pain will the patient have, and you know exactly what caused the issue. Otherwise, you're just treating a symptom, which probably 90% is doing today, because if they come from the hospital, whatever, say you have epicondylitis, you will start to treat that instead of start thinking, could it be from the neck? Because it can spread through anywhere for the nerve system, because the nerve system is a closed system. You need to be able to examine everything around the shoulder, every ligament and tendon and every muscle, and feel the different structure of the muscle to find out where the source is. We can do a hand strength test with different kind of tools, and they have pain there, but it's maybe not the source. And this you can find out when you start to treat it, and you don't get the results if you do whatever you did before. That can be very tiring, and also for the patient and for you. But learning this and using these devices, I can guarantee you, you will get a very fast and a long-term result for the patient. Knee pain. Knee pain for you as a therapist can be a nightmare. A nightmare because it can be so many things. So many referred pain or issues stop in the knee. Here, it's extremely important to know and have high sensitivity in your fingers, because the distance from the upper skin to a tendon is very little. So you need to be able to feel every single detail, and more than ever, find the nerve that is actually controlling that muscle and that tendon. Because any knee pain can be ITB syndrome, it can be patella formalis syndrome, it can be many things. You need to check every single muscle quality from top to bottom, from the hip and down, the palpation resistance. You need to search for strain damage, old injuries, even fibrosis or bad healed muscles to be able to find out the source. One thing that is really important that few see and know is that any kind of inflammation in chronically wise in the adductors will give you severe knee pain. Here you can see it on the posture the patient is walking, how they place their feet, and all of this, because every single move is a compensation for a chronic injury. Adductors is 80% the source, what we see on all patients that have severe knee pain. And this is really important information, and this is really important to learn to examine this in detail. When we talk about chronic injuries, one of the main things is to find the root cause and why we have a chronic injury. Normally, everybody, no matter injury you have, should have maybe a healing period, everything from 1 to 3 weeks, and no matter what you did, you should be healed up if it's not a fracture or total rupture. Chronic injury is more or less a thing that's been going on for a long time. It can be because of bad recovery time, or don't do any recovery at all. It can be many different reasons. It can actually be also lack of resources in your body. We need to understand the neurological and biochemical impact on a chronic injury, because it's several things here you really need to understand. No matter background you have, I'm more or less sure that after all my years experience, when this patient comes to your clinic, it's a little bit like, what do I do now? And you know your resources is limited. But also for the patient, maybe they feel hopeless. But you have a very professional, high-level knowledge of the neurological biochemical influence. You can create a trust and explanation that make the patient feel very comfortable. The neurological impact on a chronic injury is that the neural oscillation is damaged, means the nerve system's ability to send out in the right speed signals and create fusions and confirm to resource banks what needs to be done is too slow, or it doesn't exist. When this is happening, the nerve system will always try for a certain amount of time. When that time is expired, the nerve system say, we have tried, it didn't work, it doesn't heal, and it will move resource to another place. Other things that can impact all of this is, of course, the blood supply. The blood is not having high quality enough, or high bacterial toxins level, or simple, move too slow because it's very low amount of oxygen in the blood and the heart's ability to create the right temperature to speed it up, or you can have artery or veins that influence of calcifications. We need to understand this. No chronic muscle injury will be chronic if all of these would work, then the body would heal normally. The older we get, the more we stress, the more free radicals we develop, the harder and more complicated it will be for the body to heal. Then we need to understand when we have a chronic injury, you cannot only have that one place. All the negativity will spread through the nerve system, it will move toxins, it will move free radicals, it will create imbalance. And this is the knowledge you need to have to be able to make a difference for any chronic injury. If you don't have that, you will only treat the symptom and you will get the result after that. ANF therapy is a very unique therapy. During many years, it's frustrating to have high level of knowledge and understand the neurological biochemical influence on the human body and not be able to make a difference. To have the knowledge, to find out and know if I can increase the neural oscillation, I can help anyone and normalize any kind of issues. But not having this device is a scary thing. Today we have the ANF device. The ANF device is charged with neurological frequencies. No matter what frequency we talk about, you can talk about radio frequency, you can talk about resonance frequency, you can talk about MRI or CAT scan, whatever that is, building on resonance or reflecting frequencies. One thing they have in common, or ultrasound, whatever machines you're using, they cannot create fusions with cells because it's not neurological frequencies. Here is what ANF is so unique. All and every single one of our devices is charged with different neurological frequencies that impact the neurons and helping the nerve system to stimulate cells to give fusions to other cells and in this way create normalization. We have the pain and inflammation devices that is removing inflammations extremely fast compared to anyone else. When you have the biochemical and neurological knowledge and know how many different actions need to take place in the body to remove an active or chronic inflammation, and you apply this device on any injury or chronic place, and the pain goes away, like 50%, 30%, or even 100%, you will understand how advanced this device is. We have the biochemical antioxidants, and now we're not talking about the ones that we're eating, because that is probably contributing to small things in our biochemical body that is actually helping us to produce other positive resources. I'm talking about the biochemical antioxidants that is created through our antibodies and many other things during our life history to create a way to fight free radicals. These antioxidants can you not produce artificially. You can find the same name somewhere in the store, but it will not do anything to you at all. Because these antioxidants doing different things in different areas, and also everything is to help the nerve system and our organs to work perfectly. We have the anti-stress devices, and here we have several different devices to remove the neurological stress that create immune response, so the other devices can work better and actually start a healing process and remove toxins and lymphokines or BRCA, whatever creating the chronic problem. We have devices to stimulate the production of nitric oxide and helping the vasodilation of vessels and veins to create speed up in our blood flow. For that we have also the blood flow frequency. Every single frequency action that this body is taking actually have a specific frequency. You will learn to understand this, and your clinic will understand this, and you will have, every time you treat the patient, get these results, you will definitely understand what's going on. To be able to do pain reduction when you do rehabilitation, when you have post-surgery or any other patient with a big problem that have a lot of pain, then you cannot perform the right rehabilitation training because they have pain. So you need to minimize whatever you want to do with them. Imagine now you can remove that pain and increase the ROM, and you can give them proper rehabilitation. That means the patient come back to normal life faster, and you will get more satisfaction and better results and better reputation for the clinic. Improve the ROM. Maybe you work with frozen shoulders or other impact on very hard injuries and without any pain, and stimulate the blood flow, move nutrition and everything faster that you probably learned in medical school. Now you can do it with neurological frequencies. Increase the strength of a muscle by removing active inflammations or using devices that stimulate the protein release in the muscles that give you more strength and better elasticity. Improve the tissue quality by understanding the biochemical neurological function of the body, how it's healing, what do I need to do first for the body to be able to heal and create a better result for the patient and speed up the general quality of life, which is really important. ANF is working with detail. We are working that you need to think and understand what needs to be done. We will teach you how the body is actually detoxing itself so it can heal, because the body full of toxins, bacteria, or negative impacts or free radicals can never heal properly. This is why you will learn to remove inflammations first. You need to remove all obstacles to be able to heal. If you have any obstacles, it will not heal as it should be doing. It can be locally or systemically. So how do we place these devices? Depending on what injury you have, of course. But if you have a quad that have a severe strain, you of course always follow the length of the muscle. So you put positive device on top and negative in the bottom, and in between you put the antioxidants where you have carnosine, glutathione, and maybe removing the stress in the area with MC or AS. This is what you will understand and learn here. So what is really ANF accomplishing by using these devices? First of all is to normalize the neural oscillation, to restore the biochemical positive actions, and teaching the body by removing active inflammation to actually what resources need to be used. When you apply the devices, you're moving the patient's resources to that area. This is neurological frequency, and the device is active. As soon as you apply it on the skin, the body's infrared heat will activate and release the frequency in the device, which can be really hard to understand, but this is how it works. As soon as you apply it, and if you find the source, the patient will feel the difference in seconds or minutes. And you as a therapist or doctor will also notice it. And this kind of satisfaction is extremely important to understand. One thing that is really important when you're using therapy is actually to drink water. We need to understand the water have a very specific frequency, one of few that have the terahertz. And this water liquid we have in our cells is there to only helping to create fusions and connections with cells. And this is stimulated by ANF devices. This is why we need to teach the patient to drink and be hydrated. So how does a typical visit looks like for a patient here? Yeah, I will explain for you. Of course, as everybody else, we do the history and everything with the patient, or maybe read a medical report, whatever it is. But what is really important for us is actually when the patient leave here, they are better. When they come to our clinic the first time, is what we do. We examine, let's say they have a hamstring injury. We examine the area very, very detailed. We take good time because we need to check the quality of the muscle, where the injury is, and we need to check every single muscle that works together with the one that's injured. Because we don't want to treat the symptom, we need to treat the source of the problem. When we've done that and we actually find out exactly what the reason is, we decide by the palpation skills what kind of level and strength of device do I need to use. We need to learn to understand the deeper I need to go in the clinical examination, the stronger device I need to use. The more superficial the pain is, the weaker frequency I need to use. Because we need to remove the inflammation layer by layer by layer to create this long-term and effective result. We have one rule here in the clinic in Spain. When we sign out the patient, they will never come back again with the same injury. 98% of all our patients here will never come back with the same injury. They come maybe for another issue, but this is the reason why. So we apply the devices and we wait 5 minutes and hydrate the patient, and we re-examine. We increase the pressure of palpation 100% more than we did in the first examination to find out how much of the active inflammation and pain is gone. We never let the patient go out from here if the pain reduction is not more a minimum 50%. That's true, or have detox effects. What happens then is that when they have this 50% of detox effect, of course they go home because the device is active 72 hours and they will come back in 3 days, and we do exactly the same again. The questionnaire, how much better have you been during these days? When do you start to notice the effect was going down? Did you have any detox? And how did you sleep? That is very important questions. Then we do the same again. We examine the injury, of course, and 99.5% everybody improved means now I increase the strength and using stronger and stronger devices, because in the end of the treatment come to the bottom of the problem. And this procedure continues again and again. And here they of course need to drink water and then stay hydrated and listen to what we tell them to do. We have one rule here that is really important. We can help most people do better and a normal life, but they need to listen what we tell them and listen to our advice. Otherwise, don't misuse our time or your money, because this is essential to get the right progress. I want to show you guys the different categories that we work with and what you will learn how to use here. We start first with, of course, the most important, the pain and inflammation device. As you can see, is red. What is unique with this is many different actions and different layers in the tissue depending what you work with. This is just an example so you can see what we work with. You have the positive one, that is the sending outgoing frequency. This frequency is controlling and checking the injury you're going to work with and make sure to find out what kind of resources or non-resource is existing there. The negative is a return frequencies that goes from the synapses and all the way back and checking and confirming to the positive one, this is correct information. You need to work with both of these to be able to create a result. When you find a source and you apply this, you will get more or less in minutes a result that will confirm you did right and you choose the right level of pain inflammation device. We will talk about our resources and the devices for biochemical stimulation of increasing our resources. The green devices is actually our antioxidants. Antioxidants that actually remove free radicals, remove breaking, remove any obstacle that prevent the body from healing. We have the mother of them all, that is melatonin, that is a pro-hormone, that is extremely important to stimulate the liver to produce the antioxidant glutathione. Glutathione need to be high level presence in our body everywhere to be able to prevent any chronic development and prevent any autoimmune disease. We have another green one, it's called carnosine. ACA is stimulating or is our body's natural anabolic steroid. It can increase function, it repairs, it renewing cells, it prevents calcifications, and it's also present in all our body. All these three you need to understand and be able to use correctly to create the right results. We have another green one that is called NX. NX stands for nitric oxide. Nitric oxide is super important for our cardiovascular system. And this nitric oxide is actually comes from eNOS, and eNOS become nNOS, and then fuse with cholesterol and increase our vasodilation in our vessels and veins, and actually progressing and stimulating the blood circulation. Low nitric oxide will do exactly opposite. The orange, that is the blood flow. When we have the nitric oxide, this is helping to contracting our vessels and veins and helping the heart to move the blood around in our system and move resources, nutrition, and anything else that our organs, glands needs to be able to work. We need to understand the blood is our oil that is really important, is renewed all the time and get new nutrition and new resources to make our body super healthy. The blue one, this is devices, also several different. This is MC. MC have the power to remove neurological stress. Neurological stress that occurs by our emotions or any negative neurological function. If that doesn't work perfect, the nerve system can get stressed and using a lot of high level negative frequencies, and by not working perfectly, then of course the free radicals, toxins, bacteria have a chance to start mutating cells. By removing the neurological stress, all the other actions and devices can work and focus a lot better. So this is a mandatory device to use at all injuries. With these devices, you can help any patient with chronic acute injuries in any stage they are when they come to your clinic. With these devices, you will learn to combine all these different devices in different kind of combinations for different types of injuries, different type of level of injuries, to give the patient the best possible effect and result also for you. And in this way, you will also learn to design a perfect ANF protocol, a protocol that you will follow and say in your patient's amnesia. So you also remember next time they come what you did and how you need to improve and how you need to change combinations. Are you ready to learn the medicine of the future and understand the neurological biochemical impact of the human body? The medicine of the future is frequencies. Go to our website to find out more how you can start today and how this will affect your clinic and your work every single day.